So now we're going to continue with the dissection of the posterior compartment of the thigh to expose the muscles and also identify each muscle that we find in this region in relation to the vasculature also that we find in this region. Again, we'll start with removal of the skin, followed by removal of fat and exposing all the muscles. Straight incision posteriorly. Then we'll try to grab one corner that we will use to flip over the skin in order for us to get nice exposure. Start from this end, go all the way through like this. The previous dissection of the anterior compartment, as you can see at this level, helps us to know how far and deep we should go in terms of removing the fat tissue. We're just going to continue to remove the excess fat or subcutaneous tissue to try and show the muscles nicely and be able to identify the different bellies or heads of the muscles. So the group of muscles that we find posteriorly on the posterior compartment are collectively called or known as the hamstrings. We have on the lateral side the two heads that run again from the origin, that is the ischial tuberosity, going all the way laterally to insert in the fibular head. We get the biceps femoris, which has two heads, the long head that we find more medially and the lateral head we find it more laterally. And if we move on more medially, we will find the semimembranosus and the semitendinosus muscle. This muscle with a very long tendon which inserts on the medial head of the tibia is the semitendinosus. It lies just above the semimembranosus. So these two, including the biceps femoris, long head and short head, they collectively form the hamstring group of the posterior muscles of your thigh. Now, if you were to open more medially to these muscles, you can see this intramuscular septum that covers the muscles here, and there is this of our friend that we saw when we were doing the gluteal region. This big nerve continues to travel all the way in the posterior thigh to help innervate the posterior group or posterior muscles of the thigh, and that's your sciatic nerve. It will extend all the way until it goes into this groove or the space. We can just follow it. Trace it. You will see we get this region here, posterior to the thigh, here superiorly and also inferiorly here. we get this diamond-like structure. These are the superior part of this diamond structure, or forming this triangle ridge, formed by the long head of biceps femoris and the semitendinosus. So these two borders, they border the popliteal fossa. So we just need to clean this area nicely to show the popliteal fossa. This is the superior part of it, and the other part will be found here, forming a diamond. Superiorly, on medial side, we have the semitendinosus muscle. On the lateral side, we've got the long head of biceps femoris. Then inferiorly, it will be the two muscles that we find on the posterior leg. We will get to these two muscles just now. We just need to clean nicely this area and expose the structures that we find, or the contents that are found in the popliteal space or popliteal fossa. We are definitely not able to visualize the vein. So the only structures that we can see in the popliteal fossa, where we see the superior border being formed by the long head of biceps femoris and the semitendinosus, forming the superior borders. And then we can see the sciatic nerve as it comes from posteriorly, giving off several branches that will innervate the muscles. We see this one going to the long head of biceps femoris, and then this one going to the semitendinosus and semimembranosus to innervate it. And then we see a split here, more medially, getting the tibialis posterior. And here we get the common fibular nerve going more laterally. If we lift the next one that we see, it is the popliteal artery. We can confirm that by tracing back where it comes from, and we see it comes from this adductor hiatus more medially. So it will give blood supply to all the muscles that are posteriorly, and also traverse down through the inferior part of the popliteal fossa to come and supply the lower part of your leg, and then also the split, the posterior tibial nerve. We see it going all the way posteriorly to go and innervate the posterior portion. Common fibula will split into the lateral and the anterior branches. So we will move on to dissect and open up the posterior leg to see this, how these two nerves, the tibial nerve and the common fibular nerve, how they further go and split down as they go down. You need to open up the skin. Okay, so if you look over here, closer to the skin, again is the cutaneous branch or the vein that drains the skin. The saphenous vein that drains the skin, that's the small one, and it will continue to drain into here's another one, the branch. Laterally, we get the small saphenous veins. So the several branches that we will see all the way through. And unfortunately, we can't preserve them. They have to go with the skin, because our aim is to expose the muscles. Okay. Continue to remove the fascia that covers the muscles here. So here we can try to continue and appreciate the contents of the popliteal fossa that we said forms a diamond-shaped structure with two muscles binding it superiorly, the semitendinosus muscle more medially, and the long head of biceps femoris laterally. Inferiorly, you get two muscle heads or bellies. Two muscle heads of the gastrocnemius muscle. This is the gastrocnemius muscle, and you can see the medial head forming the medial superior border of the popliteal fossa, and you see the lateral head forming the lateral border of the popliteal fossa superiorly. And as previously mentioned, we have the sciatic nerve, which goes to split into the tibial nerve more posteriorly, and also the common fibular nerve more laterally. We see them going through this fossa and several branches coming off from them to supply these muscles. So we get the tibial nerve going all the way through posteriorly. If we can see the branch of it going all the way there laterally to come and innervate this region posteriorly. So now we will isolate the two bellies of this gastrocnemius muscle. We know that it attaches on the condyle here, the medial condyle and the lateral condyle of your femur. So here it should and also on the lateral condyle on the lateral side. So if it goes on to insert at the calcaneus, at the region of the calcaneus here, by means of this thick membranous tendon known as the calcaneus tendon. So the calcaneus tendon forms part of the gastrocnemius muscle. It's also referred to as the Achilles tendon. Clean it nicely to expose the Achilles tendon. Just remove the excessive fat in this region. So that you can see the borders of this muscle nicely. The gastrocnemius muscle. Just put our fingers in here to try and separate the gastrocnemius muscle. That's the medial belly. And this is your lateral belly. So if we lift them up, inferior to this gastrocnemius lies the soleus muscle, the one that they say looks like a fish. The soleus, it's this one, just beneath the two bellies of gastrocnemius muscle. We see this long tendon that suddenly just appears and runs medial to the calcaneus tendon, going all the way to combine with it and running more towards the medial malleolus. This long tendon is a tendon of the long muscle that we find posteriorly. In certain people it's there, and other people it's not there. So this is your plantaris muscle. The plantaris muscle. And the soleus muscle just beneath it. So these are the superficial muscles that we find on the posterior compartment of your calf. As we said, the gastrocnemius having the two heads that insert on the medial condyle and lateral condyle of your femur, going all the way to combine or connect with the Achilles tendon, that together with the soleus and plantaris come together to attach at the calcaneus, forming your Achilles tendon. So this is a group of your superficial muscles of the calf. We will try and isolate these more further. So following this, we will just have to cut calcaneus tendon to reflect this group of muscles in order for us to be able to look at the deeper muscles of the posterior leg. Here we can still see part of your tibial nerve as it goes more posteriorly and deep, showing that. Thank you. Showing that it also innervates the deep muscles of your posterior leg. Tibial nerve continues. So the trick here, if we want to identify the deep muscles of the posterior leg, we will have to look at the tendons that we find posteriorly and trace those tendons all the way up until we get to the muscle bellies, and they will help us to identify these muscles that we find deep to the leg posteriorly. So in the posterior compartment, we find the flexors of the leg, the flexor group muscles, and we have the acronym that we use as Tom, Dick, and Harry. Tom meaning the tibialis posterior. It's this one that is more lateral. Tibialis posterior. So you can see it originates just here posterior to the tibia, going all the way with its tendon. Then we get the flexor hallucis longus and the flexor digitorum longus. If you could see when I pull this muscle or tendon, you can see what happens to the digits. They are moving. So that means that we are pulling onto the fibularis, the flexor. Sorry, that's the flexor digitorum longus. Flexes the digits. Then the flexor hallucis longus, the tendon will go to the hallucis or the big toe. Then we have the posterior tibialis posterior muscle. So these are the three deep muscles that we find on the posterior of your leg. And we can still see also again here this tibial nerve, which continues all the way with the artery going all the way posteriorly to the malleolus, the medial malleolus, to go and innervate the region that is medial on your leg and also below your foot on the plantar surface. So that is it for the posterior compartment of your leg.